Well, tomorrow is the first day of winter and we're being warned to brace for the worst flu season in years. Adding to the concern, a new super-resistant strain of whooping cough. James Thomas has more.
She coughed and turned blue. We were in bed and woke up to a gasp and we didn't know what it was.
Oh, it's certainly an epidemic. Babies can die from whooping cough.
Almost 40,000 cases last year. Whooping cough has made a frightening comeback. Since 2008, there has been 8 deaths. Babies and the elderly are most at risk.
You need to protect them, you need to cocoon them, you need to have people around you vaccinated, and also don't take them in public places.
Diane Sherry almost lost her daughter, Tori Rose.
No words that I can tell anyone is going to give you the understanding of seeing a baby like this.
Health professionals fear a recent cut to government-funded adult vaccinations in Victoria sets a dangerous precedent for public health policy.
The vaccine is still, the only thing you can do to protect yourself, again, I emphasise, against severe whooping cough.
Westmead Children's Hospital professor Peter McIntyre attributes the current whooping cough epidemic to a number of factors, including better detection programs.
Are Australians suffering more whooping cough, or are Australians just better at finding it? And so we had tests in adults, blood tests that were done before anyone else, and so we had lots of adult cases, and now we're doing a lot more of the throat swab tests.
While incidences of the disease are increasing, severe life-threatening cases are on the decrease, which is great news. However, there are new threats emerging.
The immunity from the vaccine is wearing off more quickly.
Professor McIntyre believes this is because today's vaccines have been purified to reduce side effects. But the cleaner vaccines are seemingly less potent, and now new research is suggesting we may also be seeing the emergence of a vaccine-resistant strain of the disease.
That definitely is a worry.
In the laboratories of the University of New South Wales School of Biotechnology, Associate Professor Ruting Lan is part of a global team which discovered the vaccine-resistant strain.
If we look at the epidemic, 84% of the cases is due to this new strain. We need to bring this strain really under control.
Are you concerned about this research suggesting that there's a vaccine-resistant strain of whooping cough out there?
Well, I don't think we know that it's a vaccine-resistant strain. What we do know is that the strains have been changing of recent times, and I think the group at University of New South Wales has shown that very nicely. But we also know that the strains have changed in the past. They've been changing over time, even before vaccines, and probably the rate of change may have increased a bit with the vaccines. Can you see it?
Peter McIntyre believes it would be counterproductive to stop vaccinations due to an unsubstantiated fear that they are less effective in the face of new strains of the disease. Diane Sherry agrees.
You need to be vaccinated against whooping cough, and it's not just newborn parents, it's every adult.
As far as I know, I was vaccinated for whooping cough.
Vaccine protection for whooping cough wanes over time. Alison Vickery learnt the hard way.
You can't breathe, you're vomiting, and you're just coughing and coughing.
Every case of whooping cough, particularly fatal cases of whooping cough, it's a devastating disease. But in terms of numbers, there are really thousands of deaths every year from influenza, and that's often not recognised.
Dr Dalton is the director of the Flu Tracking Program, a web-based surveillance system run from the University of Newcastle which monitors the flu.
Every Monday morning throughout winter, over 10,000 Australians answer our survey and tell us whether they've had cough or fever in the last week. We look at that data immediately and we can track the spread of influenza-like illness right around the country.
Flu tracking is an excellent tool for public administrators, but in the case of both whooping cough and the flu, the silver bullet remains vaccination.
This is all we have to protect babies. When there's 1 in 200 babies that are dying of this disease, this is all we've got to protect our most vulnerable.
That's James Thomas.